In Ireland, as in many other countries, we are living longer and better lives. This means we have to make changes now to ensure we can provide well-planned, well-coordinated care for older people when and where they need it. This is Nora's story.
Hello, I'm Nora. Until recently, I was living on my own and was managing well, despite a few health problems. I'd been living there my whole married life. I'd friends in the neighbourhood and my daughter lived near enough. I'm 85 and my husband died a few years ago. After that, I did start to have a bit of trouble managing round the house. If I'm honest, I felt I was getting a bit forgetful at times. About a year ago, I had a fall at home and my daughter called the ambulance and I had to go to hospital. I was checked over and returned home quickly enough, but while I was still getting over that, I became sick again with an infection. My daughter started to stay with me more as I wasn't sleeping well. She also helped to make sure I took the right tablets. I was supposed to get home help and see a specialist doctor for older people, a geriatrician doctor, I think. This was taking a long time, and while I was waiting, I had another fall at home. And this time, I broke a bone in my pelvis. When I got off the trolley and into a hospital bed, between the jigs and the reels, it took a long time to see all the people I needed to see. Therapists, social workers, and every ologist under the sun. To cut a long story short, I ended up in hospital for weeks. I tried my best. The nurses and the staff took good care of me, but it was tough. It was noisy, which kept me awake at night. And I was in a busy ward with people of all ages and stages of life, coming and going with all sorts of problems. I had to keep repeating my story to the nurses and the doctors. I was in pain, too sore to move round by myself. I got lonely and was upset at times. I hated that I couldn't do normal things or take care of myself. I just wanted to go home and get back to myself. But eventually, the doctor decided I needed a nursing home, and that's where I am now.
Here's how Nora's care might have been better coordinated. Evidence shows that if we identify older people at risk earlier and coordinate services better, we will reduce longer hospital stays and avoidable long-term care. In doing so, we will enable older people to stay at home longer. A key change is that we take a long-term approach to anticipating and coordinating older people's care rather than reacting to their needs as a separate episode of care each time they present to health and social care providers. There are many examples of good care evident around Ireland. GPs and pharmacists undertake reviews of medical and pharmacy needs every day. Home helps assist older people who need help with everyday tasks. Public health nurses monitor people's health and social needs on an ongoing basis. However, the problem is that even when these services are available, they are not sufficiently coordinated by a named person who is dedicated to working with older people and who can act as a point of contact that anticipates, plans and coordinates care with the older person and their carers. Nora would have benefited from the care and support provided by a primary care team, who could have carried out an early holistic evaluation of her health, including her social care needs. This would involve a multidisciplinary team assessment by professionals trained in older persons' care, such as an occupational therapy assessment to suggest modifications or aids to her home, physiotherapy to assist with walking, social workers to ensure supports are in place to keep her involved with her community. The primary care team would link with a specialist geriatric team if and when required. To coordinate her ongoing needs, Nora would have benefited from a case manager for older persons, who would have worked with Nora and her family to develop a care plan to meet her needs. This person would act as a point of contact and coordination, who helps Nora to access services early rather than waiting for a crisis to happen. If acute inpatient hospital care was needed, steps could have been taken to improve the likelihood that Nora would have returned home. These steps include a comprehensive geriatric assessment led by a consultant geriatrician and multidisciplinary team at the time of her admission. Admission to inpatient care on a specialist geriatric ward with a healthcare team familiar with managing complex healthcare needs in older people and with access to rehabilitation. And clinical staff with specialist older person knowledge, such as advanced nurse practitioners, working with a case manager in the community to coordinate Nora's future care needs. Working together, this team would have developed a longer-term care plan that would be agreed and communicated across hospital and community services and, of course, to Nora and her family. After hospital, access to practical services in the community would have helped Nora to live comfortably in her own home. These would include help with medication, shopping, and minor repairs. This snapshot of Nora's story shows how the development of an integrated care program for older people is a priority for our health and social care services. The team leading this program are meeting and working with health and social care professionals nationwide to plan how existing care can be better coordinated to benefit older people and staff working with them. This seeks to build on a shared local vision that builds a population-based approach to integrated care that is person-centred, planned and coordinated. Find out more about integrated care services at www.hse.ie/Nora.